No matter what the setting for nursing practice or the age of the clients who are the target for nursing services, spiritual assessment is an activity which all nurses need to be able to engage in to more fully understand the client and provide more accurate care. In this program, the focus is on spiritual assessment. Why is this such an important part of the nurse's role?
If we look at what our role is as nurses generally, what our phenomena of concern is, so to speak, we look at the whole person, and the spiritual nature is part of the whole person. And I guess spiritual assessment is becoming even more crucial because people are seeing through the research and some of the anecdotal reports we're getting from people that there's a direct connection between the person's spiritual well-being and health outcomes. So in that sense, it's almost a nursing imperative to address spiritual assessment.
Spiritual assessment also provides a much-needed avenue to communicate more clearly with others who are involved with the care of the client. As well, spirituality can be overlooked as a potentially invaluable resource and strength for clients if not attended to. Spiritual assessment is an imperative which is supported by the nature of nursing, by codes of ethics in nursing, and by an emerging body of knowledge suggesting the importance of spirituality to people's well-being. It is helpful to focus for a minute on what spiritual assessment is.
Spiritual assessment is a way to understand the spirituality of the patient. And when I talk about spirituality in this sense, I look at the meaning-making process that the person goes through. Obviously, when they are ill or injured, some big change is happening in their life, and somehow they have to come to terms with that. And people do that in terms of their own life, but also what effect that has in their relationship with others, and if they believe in a higher power, what that means in that respect. So the spiritual assessment is to see how are they coping with this new situation, and how can spirituality be a resource to them in dealing with hospitalization, their illness, and their change in life.
When Rudy comments that spiritual assessment is the way to understand the spirituality of a patient, he raises an important issue. How spirituality is defined determines just what is being assessed. As well, from what I have read in the area of spirituality in nursing, and from my own nursing experience, nurses who have a clear, evident sense of their own spirituality are better able to assess and provide spiritual care.
The nurses play a really important role in connection with spiritual care, as do other people in the healthcare team, but we concentrate on the nurses in connection with being open to the area of spirituality, being able to ask some of the questions of patients and clients and residents around what's important in your life in connection with religion and spirituality, to work with some of the spiritual assessment tools that are now available, to again gather that information, and then to be sensitive to the person's needs. And it's important too that each individual and each individual nurse would have an understanding of their own spirituality and what's the importance of spirituality and religion, if religion is important to them in their own life, because it's often from our own stuff that we have a sensitivity to where other people are.
Although what we actually do assess is driven by our concept of spirituality, there are a number of common elements which are delineated in the literature. For example, religion and religious beliefs, the meaning people attribute to life or events, and the supports they have. There are many different models of spiritual assessment, each with its strengths and weaknesses. The model focused on in this program was developed by Ruth Stoll, a nurse educator. Her guide to spiritual assessment is widely used within and outside of the nursing profession. She groups key questions under 4 general areas: concept of God or deity, sources of hope and strength, religious practices, and relation between spiritual beliefs and health. It is a model which focuses on meaning and allows for assessment of the spirituality of persons who are not connected to any religion. It focuses on both beliefs and practice and is simple to use. While not all questions in Stoll's guide need to be asked of every client, each question can open a window for further exploration of the person's spirituality. Let's look now at how 3 different people respond to some of the questions in Stoll's guide.
I've been diagnosed with fibromyalgia, and fibromyalgia is a condition that's really misunderstood.
2 years ago I was quite sick. I had a growth in the common bile duct called a villus adenoma. Most times they're cancerous, but in my case it was discovered it was not cancerous, and I had to wait a week to determine that. In the process of after the operation, I got pancreatitis, and I was quite sick and in intensive care for a period of time.
I am HIV positive, and I have a mental illness. I'm bipolar. I would go through periods of depression where I may not leave my house for a very long period of time, or not do anything at all, where I would do a lot of things all at once, and do things that were inappropriate, and I knew they were inappropriate but couldn't stop myself.
God is very important to me, and it's the Christian God that I worship, and he's very important to me. In fact, to the point where I go to church regularly, and it's certainly an integral part of my life is my church involvement.
Religion is not particularly important to me. I do believe in a God, I guess, entity thing, but not in a structured way where I would, be interested in the Bible or anything like that. And I'm not always sure how that's important. It would change from time to time, and sometimes it's not important at all. But because of the HIV, I had encounters in the past with the more traditional religions, Catholicism and what may have you and stuff, that were very negative, and I didn't like that, simply because I was a woman with AIDS, and the assumptions about how that came about, because I certainly wasn't born with it, so I was guilty of something along the way, and that didn't sit well with me. And certainly to be reminded over and over and over again that I did something wrong, I don't need that. I know what I've done, and I'm okay with that.
If I didn't have the faith in God that I have, I would never have survived this, what I've been through. Never. I believe in goodness. I believe in that whatever you sow in this life, someday you'll reap. It may take longer. Sometimes you don't understand why, but what you sow, you definitely will reap. I can't really say that I can describe him as a being.